looks like they can hear us. So if you guys want to go ahead and get started.
That sounds great.
So I will go ahead and start us off. So I just want to say hello to everybody that's here. I know we have a few trickling in as we go on, but I just want to say thank you for those who are here right now for joining us for our webinar series, Residency Real Talk with Dr. Samir Desai. We are really excited to have you guys here tonight. Tonight we'll be covering the topic of residency interviews. But before we get started, I'd like to introduce myself. My name is Alyssa Harlow, and I'm the Director of Marketing here at MD2B Connect. I'm sure that I've gotten the pleasure to meet many of you, if not all of you. So I'd just like to thank you all for being here. I would also like to introduce our other team members, such as Dan Morris, our Director of Client Services, Manish Savnis, our co-founder, and Ryan Downey, our Vice President of Editorial Services, as well as the two that we have with us today, which is Dr. Samir Desai and Dr. Rajni Kata. Just as a reminder, before we get started, we welcome you guys to drop any questions that you have at any time during the webinar in the chat. We'll do our best to save some time at the end to answer your questions. And additionally, tonight we will be using a poll function for you guys to vote on various questions and answers. So we hope that you guys will enjoy participating in that as well. So without further ado, I will pass it on over to Dr. Samir Desai.
Okay, great. Thank you so much, Alyssa. I want to welcome all of our rotators. If you are rotating with us for the first time, and this is the inaugural Real Talk session that you're attending, welcome. We're glad to have you. And I wanted to remind all of you that here at MD2B Connect, we're not just about rotations. We really feel strongly about providing mentorship and support. It's something that's very near and dear to my heart, as well as our whole team. And so we try to support you in different ways. Most of you have received our book, The Successful Match. And in that book, there's over 150 pages of detailed information on interviewing. And I know that some of you who have just started rotating with us, you may not have received that book yet, but it's in the mail. You'll be getting it soon. And I wanted to bring that to your attention because I have received some questions from some of you about how to go about preparing for the residency interview, because after all, we are in that residency interview season, and that's what we need to be focused on. And so the Successful Match is a great place to start. We have some additional resources on our website, thesuccessfulmatch.com. We have an extensive blog. Many of our blog posts are centered on the residency interview, different aspects of the interviewing process. And we also have a podcast called Success in Medicine with podcast episodes devoted to other aspects of the residency interview. And during this webinar tonight, as we go through your questions and as we give you perspectives on how to maximize your interview prep, Alyssa will be sharing some links to those blog posts as well as our podcast episodes. We have received some questions from you in advance of this webinar that we are going to cover, but we also welcome you to be interactive with us. Let us know what questions are on your mind. So we try to get through as many questions as we can. And remember that we're very honored to have you with us. On our program, I consider it an honor and a privilege to have you rotate with us. And as I said before, we want to support you every step of the way. So you can always reach out to me if you have individual questions that weren't covered in this session. I'm happy to communicate with you and give you the benefit of my experience. And so before we get into all of this, I do want to introduce to you Dr. Rajni Kata, who is joining us today for the residency interview webinar. I know that for many of you, this is the first time that you are meeting her, so we are delighted to have her with us. You may or may not know that Dr. Kata is my wife, and so she's also my co-author of The Successful Match. So she has a tremendous amount of experience in residency selection. In fact, she served as a professor of dermatology at the Baylor College of Medicine for over 17 years. And in that capacity, she held various leadership roles. She was the director of the basic sciences for dermatology at Baylor, as well as a clerkship director. And she served on the residency selection committee for the dermatology residency at Baylor for many, many years. And we both bring tremendous amount of experience. I myself, as you all know, my area is internal medicine, and as a core faculty member at Baylor, I have been heavily involved in residency interviewing. So we're excited to be here with you, and I want to just let Dr. Kata say hello.
Yes, I'm honored to be here and so pleased to be speaking with all of you. And I will echo what Dr. Desai has said, which is that we really, both he and I, have a deep passion for mentoring. And it's interesting because we've been doing this long enough now, Samir, right? That many of our former mentees are now our colleagues. I have former medical students to whom I now refer patients because they're practicing dermatologists. So mentoring and supporting our students is really at the core of what we do. So in terms of tonight's event, we really want to make sure that we are responding to your questions. And so I'll pass it back to you.
Great. So, Alyssa, do you want to start us off?
Yes, absolutely. So are we just starting off with the questions then, Dr. Desai?
We're going to go right into the questions because I want to use as much time as possible because I know a lot of people have some concerns and issues that they would like us to address.
Okay, absolutely. So our first question is, if we have a question for multiple interviews, how should we address them? For example, have you doctors heard about so-and-so? So that's one question.
Okay, so let's stop there for a minute. I'm not sure that I fully understand the question. I think what they may be referring to is that if there are multiple interviewers that are interviewing you at the same time, that is what we would call a panel interview. And that does happen. Most interviews are one-on-one, but it's not unusual to have a panel interview. And in a panel interview, if you have questions to ask, you are going to direct it to the entire group. You don't necessarily have to single anybody out of that group to ask your question. You can present your question, and then what the group will do is decide amongst themselves who will field that question. And sometimes, as the initial person who's answering the question, that faculty member completes their thought, sometimes the other parties involved in that panel interview may chime in and offer some additional perspectives. And I know, Rajani, that you've done a lot of panel interviews before, so do you want to comment on that?
Yeah, no, I would just echo what you said. So typically in dermatology, the way we did it at Baylor was it was myself and my colleague. Sometimes there were two of us, sometimes there were three of us, and we took turns asking questions. And so the best is to start off your response with the person who asked you your question, but then make sure you're making eye contact with every one of the interviewers. And of course, it's a little bit different in a virtual interview. You're going to be looking at the camera. And in terms of what you would say, you could say, Dr. Kata, thank you for asking me that question, but you don't have to specifically address the person who asked you the question.
Okay. So are we ready to move on to our next question?
Yes.
Okay. So our next question is, I used an interview prep company to help me with prep. Is it okay to mention it? I obviously won't volunteer this information, but again, I'm worried it might come up.
So if you are getting assistance from anyone, whether it's an interview prep company or a mentor or a friend or family member, it's not necessary to bring that up during an interview. It would be highly unusual for someone to ask that question. In fact, in the 20 plus years that I've been advising and mentoring students, I have never had anybody asked, did you use an interview prep company to prepare for your interview? Rajni, have you ever encountered that situation?
Never encountered that question. I would say if somebody like flat out asked you, which I've never heard of that happening, you could say my mentor, Dr. Desai, helped me with interview prep. Just mention instead of a company, stick with a specific person. I think you should be fine.
So I think in the off chance, the unlikely chance that something like that is asked, what Dr. Kata advised, I think, is a great recommendation.
Okay.
And Alyssa, I know that there was 2 questions. I might take the next 2 because they were repeats. And this is a question that we had from several of our students tonight, but also that is something that I'm frequently asked by my mentees, and that is, what questions should I be asking during the interview? And Samir and I have written, of course, it's in the book. It's also, I would recommend that you see our most recent blog post about this. You know, what questions should you ask during a residency interview? And I think this is a really important blog post for you to look over in depth. And that is because when, what I found is that my students prepare really heavily for questions like, what are your strengths? What are your weaknesses? And I don't think enough thought is given to the question, what questions do you have for me? And if I were to, and Samir, you'll have to tell me your thoughts, but if I were to rank the questions that are most commonly asked, the number 1 question that's most commonly asked is probably, tell me about yourself. And the second most common question is, what questions do you have for me? And in most interviews, an interviewer is going to ask you that question because it's a signal that they're wrapping up. So, you know, Sarah, this was a really great chance to have a conversation with you. Do you have any questions for me? And what I found over, you know, the decade and a half that I was interviewing is that most applicants, when they asked me questions, sounded very similar. So most applicants would ask something along the lines of, Dr. Kata, do you anticipate any changes, you know, in the program in the next few years? Dr. Kata, what would you say is one of the greatest strengths of your program? Or is there anything about the program that you think could be improved upon? Those were kind of the most common questions that I would hear from applicants. And there's nothing wrong with those questions at all. Those are solid questions, but it also represents a missed opportunity because your whole goal in asking questions is to, I mean, these are questions that you really care to hear the response to. And at the way in which you ask it can highlight something about what you're interested in, and it can highlight something about how well you fit with this program. So Samir, should we do an example of how to ask a question?
Sure, sure. And before we do that, I'll just add that there are some interviewers, we know this from the literature and residency selection, that would look at the questions that they're being, you know, received and kind of use that to even rate an applicant. In other words, the quality of questions that you ask could be, depending on the interviewer, something that they're looking at to give an overall picture of you as an applicant. So, getting back to, you know, what Rajani was saying, I can give you an example of something that you can do to elevate the type of question that you ask. And again, before I give you the example, I'm a big believer, and Dr. Kata is as well, that the questions that you ask should really come from your heart. Things that are meaningful to you, things that you would want to know about that program, because this is really your opportunity to learn about that. Because as you all know, the website information varies tremendously from one program to another. Some are very robust, and you can get a lot of information, things that you want to know, and others are lacking in some respect or another. So this is your opportunity to get that information that you need. And so, to give you an example of what you can do with a question in terms of asking it, let us say yeah.
Actually, Samir, can I first start? Can we do a before and after for this?
For sure.
Okay, so Samir, I'm so happy that you're interviewing with us today. This was a really productive conversation. Do you have any questions for me?
Yes, so I was wondering if what kind of teaching opportunities do the residents have in your program?
That's a good question.
So
That.
yeah,
Now,
yeah, go ahead.
no, please, you.
So that's a typical question, okay? Or somebody might say, what kind of research opportunities do you have in your program? And it's not to say that that question is a bad question. If on the website there is no information on the teaching opportunities, and during the orientation on the interview day, the program director doesn't mention anything, then and that's something that you really want to know about, that's a reasonable question. But quite often, asking a question about teaching, we'll just use that as an example, can be an opportunity for you to highlight something about yourself. Okay. So, for example, you could ask, a question that sounds, something like this, you know, uh, Dr. Smith, I wanted to ask you about teaching opportunities in the residency program because, in the past, I've really enjoyed teaching others. In medical school, I served as a teaching assistant for my pharmacology class, and it was one of the most fulfilling experiences that I had. And I really would like to continue my growth as a teacher. And so I know at your program that there are different opportunities to grow as a teacher. I came across on your website that you have a very uh, useful workshop to help residents become teachers. And I was wondering if you could tell me more about that particular workshop.
Okay, so I think everybody can see a few really important points about that response. The before one was, are there any teaching opportunities here at your program? But the way Dr. Desai just presented it, he really highlighted that he himself has an interest in teaching. He has experience in that. He's really made himself stand out. I don't think there's anybody else that could have possibly asked that particular question. And then it also highlighted the fact that he had researched the program, that he knew that there was a workshop right there. So that's another key benefit. And then the third key benefit is he's really trying to emphasize that he fits with their program. He has teaching experience. That's something that's important to him. The program is offering a workshop, so clearly that's important to the program. So one of the key goals of your interview is to really emphasize how well you fit with the program's mission and goals and strengths. And so asking a question like this is starting to get to that point. Go
And
ahead.
I'm sorry, I want to add a couple of things about that. So, to some extent, the way you're going to phrase a question like that is also going to be based on what you've covered in an interview to that point. So, if you've been asked about your work as a teaching assistant in pharmacology, you may not have to go into the depth that I did. You still want to link it to what you're asking, but to some extent, you have to kind of tailor the question based on what's happened before. What I see happen a lot with applicants is they'll ask a question that is very meaningful, but it'll be what I call a standalone question. In other words, to the interviewer, it's not at all apparent why the applicant is asking the question. So when you link what you're asking with something in your background, then it becomes very apparent to the interviewer why that question is significant to you. And that also highlights another important point is that you should not assume that the interviewer knows everything about you from your application. And that's why phrasing questions like this can either reiterate important things you want to get across to the interviewer or really make them aware of something that they may not be as aware of as you think they
And Samir, this is such an important question that they're going to ask you. Do you want to give us an example of the research one? Go ahead and do a quick before and after about research.
are. So you might do something to the effect of uh, the before might be I know your residents have a lot of research opportunities here in your program. How do residents choose among the different possibilities in terms of what projects they'll do? That might be your before question. Okay. Um, Another, something that's a little more rich, right? Might be something like, you know, I've been fortunate to take part in a lot of research in medical school. I took a year out to be involved in a research program. And what that taught me is that I want to make research an important part of my career. One of the things that I love about your program is that you have 6 months of dedicated research time in your second year that residents can really benefit from. And the question that I had for you is, what can somebody like myself do in the first year of residency to set themselves up to have a productive experience during that 6 months of protected time? That's an example of something related to research that you could have created as an after answer.
Yeah, I think that we're having a little bit of a network issue with Regini real quick. But if you want, we can move on to the next question.
Absolutely. What's the next question?
Okay. So our next question kind of has to do with what we were already talking about. So it just says, if not asked, should I explain my lack of research? One of the programs I'm interviewing at stated that they value this kind of experience, and I want them to know I would like to do research. I just didn't really have any opportunities before.
Yeah, no, that's a very good question. So remember that programs have different areas of interest. So most programs are not looking for researchers, right? Most programs are first and foremost looking for clinicians, right? Their primary goal is to help their residents mature into highly competent clinicians. But all residency programs have additional goals, and there may be some that place varying amounts of importance on research. And with that being the case, if that is a program where you're going to, and you don't have a history of being involved in research, you may want to think very carefully about how to answer that. And I'll just bring Dr. Kata up to speed on what we're talking about. Rajani, can you hear us?
Now I can.
Okay, perfect. So there's a question that's being asked that if I go to a residency program that values research, but I have not had any opportunities to engage in research, how should I handle that? If that comes up. And so one of the things to remember is that it may not come up because that particular program might have looked at you and have been very impressed with the other aspects of your candidacy, right? As I said before, research may be one part of what they value, but it's not going to be the only thing that they value. But we should still talk about what to do if that question is asked. And I think an important thing to do is to talk about, what scholarly activities you've been involved in. So you may have not been involved in a research project, but were you involved in some sort of independent investigation? Were you involved in a journal club? Were you involved in activities that have made you stronger in terms of appraising the scientific literature? So some of these qualities that you pick up through being in research, have you acquired those skills by other means? Okay, so that can be part of your answer. Reggie, did you want to add to that?
Oh, that sounds strong.
And on top of that, remember that there are qualities that you have demonstrated in your other activities that are transferable to performing research. And so, whatever that is, you being detail oriented, you being organized, you being a great manager of your time, these are the things that also transfer to being an effective researcher. Now, if you are concerned that your lack of research might be a detriment to the way that they look at you as a candidate, you can also think about what steps you could take to start building a foundation in research. So one of the things that I advocate is we are here in October. You won't start residency till late June. So there's a number of things that could possibly be done in a particular area to strengthen yourself over time. And so that can become part of your answer. Maybe the end of your answer is where you give them a very, very, strong answer about the steps you're going to be taking. Maybe that means you're going to take an online course at the NIH, which is going to ground you in research principles, or maybe that's going to be at Harvard or any one of a number of places, right? So this is how you have to think about the framework for that type of question.
Okay.
Okay, Alyssa.
So, did you guys want to take a couple questions from the chat?
Yeah, actually, I think this is a good one, Samir, because this is a really foundational question that many programs are going to ask you, and that is, why are you interested in our program? And there's different ways that you could be asked this question. One of the key points that Dr. Desai and I really emphasize is that, I mean, there may be 300 potential interview questions that you might be asked, but a lot of them boil down to about 25 to 30 parent interview questions. And so if you are asked a question, you need to think back to sort of those big parent interview questions. And one of them is, why this residency program? So what type of program are you looking for? What are you looking for in a residency program? What are you looking for during your training? Why did you apply to our program? Why are you interested in our program? Those are all variations of the same question. So Samir, would you like to give us an example of your approach?
Absolutely. Before I give you an example of how I might answer the why are you interested in our program, I just want to highlight something that Dr. Kata just said, and that is there are a number of ways to ask the same question. And a big part of your prep is trying to understand how these questions are related to each other. We actually have a blog post where we've categorized questions in groups. But what we're trying to do in that blog post is share with you that questions that are related to one another. So there's a base question, and then there's many variations of that base question. And it's important to categorize questions in that way, because then when you get asked something that seems a little bit foreign, you'll realize that it's something that you've already prepared for. Okay. So that's a very, very important part of your prep. And I know Alyssa can share that link to that blog post, which I think is a very, very important article to read. Now, getting back to why are you interested in our program? So, the typical answers that we tend to get, I'll tell you from the internal medicine side, and then Rajni, you can share with us what you heard from the dermatology side. But a lot of interviewees that I meet will say, I love your Baylor program because you have so many hospitals. You spend time at a veterans hospital and a county hospital, and then there's MD Anderson, and then they'll move on to another point where they say, you have these great didactics where they're really known for their quality, and your faculty is very, very dedicated to helping their residents master this material for internal medicine, and then they'll keep going on, and then you have such strong subspecialty departments because I really see myself doing a fellowship after I finish. So these are what the typical answer sounds like. Would you agree with that, Rajni?
Absolutely. Diversity of, I'm so interested in this program because you have a really diverse patient population. And I know that I would get great training, and the fact that you have grand rounds and your didactic lecture series. And then I know your residents have been able to do fellowships, and, it all sounds very similar to what you just described.
Absolutely. And so there's nothing wrong with talking about some of these points, but you want to make them specific as possible. And you want to, again, try to tie it to your own background and situation. And so what we're trying to advocate here is you want to make these answers your own. You don't want to sound like everybody else. And so when you create your why are you interested in our program answer, I would recommend that you take a step back and ask yourself, could somebody else say the exact same thing? Because if somebody could, that means there's room for improvement. Okay, and the good news is we can definitely improve this answer and create something that sounds fresh and unique to you. So to give you an example of what one of those points can sound like, if you're asked this question, why are you interested in our program? I might say something to the effect of, one thing that draws me to your program is the quality of your didactics. Uh, I remember that when I did one of my clinical rotations, uh, the the attending that I was working with really uh, filled me in on morbidity and mortality conferences and how important those were in residency training. And I saw that you have this very well regarded morbidity and mortality conference where the residents present these cases where unfortunately there have been poor outcomes, and then a seasoned faculty member breaks down the case, so by the end of the discussion you have a strong understanding of where the breakdowns occurred, whether they occurred at the provider level or there was a breakdown in the system. And that really appeals to me because I want to be somebody who works hard to help my patients have the best outcomes, and understanding how I can do that as an individual physician but also do it as part of a system is going to be something that I think is vital for my career.
One thing I want to highlight about what Dr. Desai just said is that the key to answering this question really well is to have researched this residency program really well. You're certainly going to learn something about the residency program on your interview day, but even before you show up for the interview, probably the most time consuming part of preparing for residency interviews is researching the individual programs. You definitely have to spend, well, I'd say it's kind of three buckets. The first bucket is to really reflect on your background. So everything in your application, you have to really know it well. You might be asked about your research, your volunteer experiences. You need to know your own application really well, even if there was an activity that was from 6 years ago. You need to know it well. You need to be able to speak about it. You also have to reflect. And we don't necessarily talk a lot about the process of reflection in daily life, but when I say reflect, you need to start looking back at all of the amazing things that you've done and start thinking about, what does that say about your strengths, your qualities? What does it say about your goals? What does it say about your motivations? It's really important to sit down and do that analysis, to take that time reflecting, because that's really going to impact the responses that you give. And then the second bucket of time for your interview prep is, doing mock interviews, practicing your responses, thinking about what you're going to say. And the third big bucket that I think about is the amount of time that you're going to have to spend researching individual residency programs. So if you are blessed to have 10 interviews, that is a lot of research that you're going to have to do. And when we talk about research, it's not just, looking on the website. You can start with the website, but you have to go beyond that. We really talk about how you want to start looking at the institution's website, then the departmental website. You want to look at some of their press releases. What are they in the news for? What are some of their initiatives? And then you might be talking to current residents of the program. You might talk to current mentors of your program, and you're trying to find out more about the program. What are they known for? What do they want to be known for? What makes the program unique? What are the opportunities there that you might not find elsewhere? What are the program's missions or goals? Are they really focused on research? Are they really focused on care for the underserved? Are they focused on producing primary care clinicians who are going to go out into rural communities? Programs differ quite a bit in all of those. So it's really important to spend the time doing that research. And then that will help you inform why this residency program, what you really want to do is make that connection between your interests, strengths, and goals and the program's interest, strength, and mission. You really want to try to emphasize any areas where you overlap to really bring it home why you are interested in this particular residency program.
I
Samir?
agree 100%. I mean, I'll just reinforce what you just said, that your interest in a program. So this question is about, what exactly is your interest? Why are you interested in the program? But your perceived interest in a program is incredibly important to these training programs. We know that from the NRMP data, from the program director survey that asks this question. And in a recent survey, 70 to 75% of internal medicine programs use perceived, your interest in the program to make rank order decisions. So the more specific you are, the more what you're saying aligns with what they have, which requires you to reflect on where you've been and to understand what they have and what their, as Dr. Kata said, their goals, their mission, their purpose. That will allow you to communicate the fit that you're trying to communicate through the answer to this question.
Yeah. And we have a blog post on this topic. Why are you interested in this residency program? I have a separate post for applicants to medical school where I talk about doing an activity analysis. And that's probably something that would be helpful for you to look at. I have a residency interview course where I have worksheets, but those worksheets are also on the blog post. So there's a worksheet on an activity analysis, and there's a worksheet on researching a residency program, because I talk about the AEIOU approach, where when you start researching a residency program, I actually have people fill out a worksheet. What are the aims of the programs? What are, and you can go through that that mnemonic, but basically you're looking for the aims, areas of excellence, what are the opportunities here, what are the unique features of the program. So you really do have to spend time in order to be able to answer this question well.
And that's a very good exercise to go through. I think a lot of applicants jump past these points, and you don't want to take shortcuts here, because this arguably is the most important question.
Yeah, fit, that emphasizing fit. I can't emphasize enough how important that is for a residency program director. Is this somebody who's going to be happy here? And is this somebody who's going to fit in with what we have to offer? And are they going to help us reach our goals? All right, Alyssa, back to you.
I think we have another very common question that we can answer. So one of the common questions was, when is the best time to send a letter of interest?
Samir, I'll let you take this one.
Yeah. So different specialties handle interview season, right, in their own ways. Some specialties get off to an earlier start. Some specialties are known to send interview invitations later in the season. Then, of course, in any one specialty, you have programs that operate differently. So in an ideal world, you would send letters of interest knowing when those interview invitations are sent out. In other words, the program would be fully transparent with you that, hey, our interview invitations go out on X week or Y week. Some programs do make that clear, but unfortunately, the wide range of programs don't. So with that in mind, we should ask ourselves, when are these interview invitations given? So typically, October is an important month. Somewhere around 30% of interview invitations are released in October. November is another big month. So October, November are your big months. And so what I usually tell people is, into October, around the third week or so, sending out these letters of interest, that's a good time to do it, because they've had your application for a few weeks. So we need to give them some time to process your application. But then, sometime around that third week sending those out. Now, of course, that's a generalization. If you are hearing, you have your ear to the ground and you're hearing that this program has sent out their first batch of interview invitations, then there's nothing that says you need to wait till the third week. You could do that now because you've gotten information now that that first group of applicants have gotten some interviews. So again, you have to sort of individualize it and keep your ear on the ground and be aware of what's happening. And obviously, right now in the era that we're living in with Discord and Reddit and all of these resources, you can get an idea from those who are in this process with you when people are receiving invitations.
And along that same line, there's another question that I'm seeing here about thank you notes. And thank you notes are a form of what we call post-interview communication. And there are different types of post-interview communication. There's thank you notes, and then there's also letters of intent. But this was a question we got quite a bit last year, and so we created a blog post on the residency thank you note. So we have a lot of guidelines there and some sample thank you notes for after a residency interview. And then the question, I think, was also, do you send it to, how soon should I write it? And should I address the email to individual interviewers, or is it okay to write a group email? So I'll speak in dermatology. My applicants were typically sending thank you notes within 24 hours. So they were composing them on the plane back home. And it was not common to get a group email. These were typically sent to individual interviewers. And the reason for that is because the best thing is to include a little memory spark. So Dr. Kata, thank you so much for the opportunity to interview at Baylor Dermatology. I had a fantastic day and I really enjoyed speaking to the residents. I also really enjoyed our conversation, speaking about my research on vitamin D, photogenesis. And I also really loved hearing about your favorite Mexican restaurants in Houston. Thank you again for the opportunity to interview. So it definitely takes longer to create these kind of individual personalized thank you notes. But if you're going to do it, I recommend that you do it right. So Samir, my applicants were typically within 24 hours sending those thank you notes. What about your applicants?
In the 20 plus years that I've been interviewing internal medicine residency applicants at Baylor, I can probably count on both hands how many people got thank you notes to me within 24 hours. So very few. And those are the people that I remember really, really well. And so I would encourage all of you to be timely with those thank you notes, because it can make, and it's part of the impression that you're making. Now, will you be sending thank you notes to every program? Now, keep in mind that some programs have a policy for no post-interview communication in the form of thank you notes. So if you ever see that from a program, either on their website or on the interview day, you want to respect that and not send a thank you note. But for programs that don't have that policy, I think it's important to send a thank you note in a timely fashion to your individual interviewers.
Okay. And Alyssa, I want to make sure that we get to all the questions that were sent ahead of time. Do you have any other questions?
Yeah, I do. So the next question is actually also a common question that we had, which was about how to set up the place where you're doing virtual interviews. So the first question was, what would be the ideal positioning of the webcam? And should one have it in a way that the view is waist up so that hand gestures are possible?
Okay, and I can take this one. So I think everybody who has an interview absolutely has to read two of our blog posts. And one is how to prepare for the virtual interview, and one is how to ace the virtual interview. And this is really important because Dr. Desai and I have both spoken, we've thought really long and hard about virtual interviews, and the fact that you have a virtual presence, a virtual first impression, In the real world, your handshake is so important. The way you walk in, your posture, but the correlates of that in the virtual environment are still just as important. So I highly, highly recommend that everybody read those 2 blog posts. In terms of these specific questions, I do recommend waist up. I think it is really important to have hand gestures be visible and to be appropriate. I am not seated ideally, but the rule of thumb is that you should be eye level with your laptop computer. So I am not at the moment eye level with my laptop computer, but with the laptop camera, that's the general rule of thumb. You really need to think about lighting and background. So there are definitely things to consider with the virtual interview. I'm glad you're asking that question. So important. Samir, did you have anything to add to that?
I want to echo what you just said about, do take a look at those blog posts on virtual interviewing. We also have a podcast episode where we go into a tremendous amount of depth into the technological aspects of virtual interviewing, as well as the environmental considerations that we need to be aware of. I find that, again, people understandably are spending most of their time coming up with compelling answers to these interview questions, but some time needs to be spent on the technological and environmental considerations, because if you don't think about all those considerations, it can make it difficult for you to achieve what you've set out to achieve, which is making that fully favorable impression on that interview.
Yeah, it's really something you need to spend time on. And one of the reasons that Dr. Desai and I like to do podcasts as well is because it's we can go into more depth. So we can speak for 30 minutes on the virtual interview, and podcasts are wonderful for when you're exercising. So if you're going for your walk or your jog, it's an easier way sometimes for people to absorb that information. All right, Alyssa.
I will just say one more thing, that uh, never imagined that we would go through the pandemic, and before the pandemic was on anybody's radar. I was doing virtual interviewing. So I've been doing virtual interviewing for about 15 years, because I do mock interviews with people all over the world. And so over those years, I've seen what can go wrong in these virtual interviews, and it happens a lot. And when I do real interviews, I see some of those same things. So the good news is we can control a lot of that. Now, can we control everything? No, sometimes something unpredictable can happen. But if we run through all the different things, technologically, environmentally, we are less likely to be affected by something. And that's what we want to do, because you're putting in your heart and soul into creating these wonderful answers.
Okay, Alyssa, back to you for the next question.
Okay. So I think our next question is also a very common question that we've had, and it is how to approach the question, tell me about yourself.
Samir, I'll let you take it.
Okay.
This is your favorite question, isn't it?
I don't know that I would say it's my favorite question, but it's a common question, right? So this is the most common question that kicks off an interview. And it's also a question that keeps applicants up at night, because we don't have any science that tells us how this question should be answered. And given that there are so many different personalities out there that are doing the interviewing, it makes things a little bit difficult. What should you cover? Should it be all professional? Should there be a mix between professional and personal? So these are some of the things that enter the minds of applicants, and that's very, very understandable. So the way I would look at tell me about yourself is I would look at it as what we call a positioning question, and your answer being a positioning statement. So what do I mean by that? So what I mean by that is the material you include in your tell me about yourself answer positions you for, quite often, the next question you're going to get. Because a lot of interviewers, their follow-up question to tell me about yourself is going to be based on something that you said in your tell me about yourself answer. So with that being the case, you have a chance to exert some degree of control over where this interview goes. So if you're very careful and you include some compelling material, chances are good that that next question is going to be about that compelling aspect of your background. So in other words, you can move this in the direction of something that you're strong in. And wouldn't you love to do that, right? That would, be great if you had an opportunity to really hit the ground running in an interview by letting that interview move in that direction. So that's an important part of what you're trying to do. Now, in creating this question, you also have to remember what these interviewers are like. So not all interviewers are created the same. So you have different types. So you have the first type that are what we call hawks. So these hawks are going to look at everything in your application. They're going to read every line of your application, every line of your personal statement, word for word. They're going to know you very well before they start to interview you. That's your first group. Your second group are what we know as skimmers. So they're going to be skimming your application. Hard to say when they're skimming your application. It could have been last night, could have been a couple hours before the interview, or maybe a few minutes before your virtual interview. So that's your second group, and it may be hard to know what they have retained from their skimming. And then you have your third group of interviewers who, believe it or not, have not looked at your application and are looking at your application for the first time. So in order to meet the needs of this very diverse group of interviewers, you have to make sure that you include some compelling information about you that you would like them to ask you questions about. And sometimes what I advise applicants is thinking about what that program is trying to do, like what are their goals, what are their mission, and again, starting to even show at this early point in interview that you have a fit with that by introducing something that would appeal to them.
Samir, can you give us an example using, let's say, yourself as the applicant and Baylor Internal Medicine as the program?
Sure. So, I might say something to the effect of,
It doesn't actually have to be you. You can pretend you're somebody else.
No, absolutely. I appreciate you putting me on the spot. So basically, it's a good question. So here's something that I might do. So I might say, I was born and raised in Detroit, Michigan, and during my high school and college years, I really discovered a passion for teaching. I served as a teaching assistant and continued to work as a tutor, and it made me realize how much enjoyment I get out of helping guide others through whatever difficulties they're experiencing. And so when I went to medical school at Wayne State University, I was excited to continue my growth as a teacher. And then I also discovered something else that was very important about myself, and that is that I enjoyed mentoring. I was very fortunate to have some attendings who were great role models, and they really mentored me and helped make me, not make some of the mistakes that I might have made. And then I wanted to, get a feel for that myself. So when I was an upperclassman at Wayne State, I started mentoring some of the underclassmen, and I realized that, in my career, I want to teach and mentor. And so when I was looking for a program, I was looking for a program that would help me build a foundation in those areas, in addition to helping me grow into a competent clinician. And so when I came across your program and I saw that you have so many workshops here that help build residents in these areas, residents become stronger teachers, residents have opportunities to mentor by serving as advisors in the student interest groups. I was so excited because I knew that I found the program that's going to help me get to where I want to be and contribute in the profession as both a clinician as well as a teacher and a mentor.
Okay. So, the sweet spot for this is, if you consider Tell Me About Yourself as a positioning statement, the sweet spot is typically 1.5 to 2 minutes. And Dr. Desai would have adjusted this based on where he was and the factors that you just mentioned, who's asking that question. And you might have followed it up with, and I'm so excited to be here in Chicago. I love, I love ice skating, whatever it is. Like, you can take this in different directions. And I think the question was also, is it professional or is it personal? And typically it's a combination of both. And a lot of people use chronology. That's one way to approach it. There are other ways to do the tell me about yourself. But it is that combination and highlighting those. Samir, other comments?
Well, what I would say is, that anything that you put in your tell me about yourself answer is the basis for a follow-up question. Okay, so if you think about what I mentioned, they could ask me about growing up in Detroit or in Michigan, about my early years in high school and college when I was serving as a teaching assistant and tutoring. They might want to know more about what I was doing at that point. So I could get a follow-up question saying, "Oh, I'd like to know more about when you served as a teaching assistant, or tell me about your tutoring." And then when I took the answer into medical school and I introduced the mentoring, they might ask me about my experience as a mentor, mentoring underclassmen. And they might ask me, "Oh, it's interesting you developed these interests in teaching and mentoring. How do you see that evolving throughout your career?" So anything that I've just mentioned here, whether it's professional or personal, you have to be ready to answer the follow-up question, which quite often is, "Oh, tell me about this."
Yeah.
But it can be to your advantage, right? Because you are exerting, like I said, some possible control over where this interview goes. And I constructed my answer because that's a lot of my career has been in teaching and mentoring. So when Dr. Kata asked me, would you do, I decided to focus the sample answer on teaching and mentoring.
Okay. You guys want to move on to our next question?
Yes.
Okay. So I believe that this question is referring to interview time slots. And the question is it really first come, first serve? I learned that for really good programs, we should delay for late November and early December. And for low tier places, we should schedule for early November. Am I safe interviewing even after December?
Yeah, so I can answer that question. So we've had a lot of research on timing of interviews and whether that affects success in the match. And the overall body of evidence indicates that it doesn't really matter when you interview in terms of, your chances of matching. Now, where you hear the advice of, certain programs you should interview at first, early in the season, generally has to do with, if you're in the situation where you have lots of interviews, you'd like to pick some programs to go to or to interview with that perhaps are not your most coveted programs. And that's in the early period. Because in that early period, when you're just getting your feet wet and you're in that interview prep, you may not be performing at your peak level in those first few interviews. So once you have a few interviews under your belt, and you've gotten used to what it's like, and you feel a little more comfortable and confident, now you're going to be moving towards your peak. And so if those coveted programs are later in the season, whether it's, November or December, then you're going to be more seasoned and ready to show your best stuff. Reggie, did you want to add anything to that?
No, I think that's a good response. And I think if you're ready, Samir, we can do a few rapid fire questions since we're coming to the end of the webinar. You ready? Rapid fire?
Yeah.
One of the questions was, if you are asked a question for which you are not prepared, and I'll take this one. I actually wrote a blog post on this, what to do if you don't know the answer to the question. So I'd recommend looking over that blog post because I do have some strategies to use if you're asked a question that you're just not prepared for. And one of the best strategies is to say, that's a really good question. Do you mind if I take a minute to think about that? I do have some phrases like that I have ready to go in my pocket for times when I am not ready for a particular question. Samir, I'll ask you this question. For a letter of interest, should we email the program coordinator or the program director?
preferably the program director. However, the program director's email is not always accessible. So if you can't find the program director's email, you can definitely email the program coordinator. The two are working side by side very closely. They pretty much know everything that's going on during an interview season. That's the nature of the business. So ideally to the program director, but if you can't find it, don't lose sleep over it. You can send it to the program coordinator. Remember that there are also some associate program directors, right, for every program. So those people also you could send this to if you can't find the program directors.
Okay. And then I do want to highlight, we did a podcast episode on red flags during the interview. So somebody had asked about a gap during medical school education. And we had a podcast episode about how to address red flags during your interview that you might find helpful. And then if you are interviewed by a panel made up of faculty and there's no resident there and you want to ask resident related questions, what should you do, Samir?
I'm sorry, you cut out for a minute.
Okay. Well, I can answer this as well. If you are only being interviewed by faculty and you want to ask the resident some question, don't ask a resident related question to the faculty, but most programs will make residents available to you at some point during the interview day so that you'll be able to speak to some residents. So you can hold on to your questions until you get to meet with the residents.
Okay, do we have anything else? Any other questions?
Alyssa, do you think we have time for one more question?
Absolutely. I think we can answer one more question. So I think that this is a really good question that we can answer, and it is, how do you know if you're a good fit for the program, and how should you rank a program based on interview impression?
Okay, so how do you know you're a good fit for a program? So first of all, it's about acquiring as much information about the program as possible in advance of your interview. So this goes back to what Dr. Kata was saying earlier about doing your due diligence with the research of each program. Look at that program website, look at the departmental website, look at the different sections of the medical school website as it pertains to that particular department. Do your Google Scholar search, your PubMed search, learn about the faculty. So there's a lot of sources of information. Talk to people who know something about the program. So get as much information as you can so you can really understand what that program's all about. And then if you've done your reflection, then you can get an idea of how what you're trying to achieve or where you're trying to go aligns with what they're trying to do. And then, of course, you're going to get additional information with the residency program specific activities. So whether there's a meet and greet or a session with the residents, and then your actual interview day, there's going to be some programming, right? There'll be an orientation, typically led by the program director. So you're going to get a lot of information from that program, and that really helps you determine what that fit is like. On top of that, you know, again, even after the program, you finish interviewing, you can ask follow-up questions. If there's something you're not sure about the program, they often welcome those follow-up questions. So I think that's the first part of the question. Reggie, did you want to take the second part?
No, you can go ahead.
Okay, so as far as how do you, I think the second part was how do you rank the programs based on fit? Was that Alyssa? Is that right?
Yes. Yeah, that was the question.
So that depends on, you know, where the fit is, right? So when you're talking about fit with a program, what you're trying to determine is how are you fitting with the program, and those factors that are leading to a fit with the program, where do those rank in terms of importance relative to other things? And for every person, that's a highly individual decision, right? There's a lot that goes into ranking programs because there's so many different factors and criteria that are possibly used in the ranking process. And obviously fit is one of them, an important part, but the whole concept of fit, the makeup, what makes fit could be any one of a number of factors, right? It's not always just one factor that creates the fit. There could be multiple things. And you have to weigh how those things are going to be ranked in your mind.
Okay. I think that was our final question. I know didn't really get the chance to get to the polls tonight, but did you guys just want to do one poll question? I think that there's one particularly that we could respond on.
Go for it, Alyssa.
Okay, so I will go ahead and start the poll. So the poll is, how nervous are you about interviewing for residency? So if you guys can please vote, and we will go ahead and respond. Just going to give everybody a couple seconds to respond. So. While we're doing that, I do have a couple articles about how to control your anxiety and how to control the stress that comes around doing interviews. So I'll be sharing those in the chat as well. So it looks like a majority of people commented that it is a moderate amount and that it sometimes wakes them up at night. So that was the result of the poll.
So let me just comment on that as we get close to wrapping this up. You know, if you are preparing for an interview and you're feeling those nerves, remember that that's a normal thing, okay? And one of the best ways to keep control over those nerves is by the preparation that you're doing, right? That work that you're putting in. And as you're putting in that work, always remember that program is excited about you. You're not going to get an interview unless they're excited about you. So they're eager to meet you. They have looked at your background, your experiences, and they have said that this is someone that we want to meet. And that's why they've given you an interview. So they are eager and excited to meet you. And now what they want to do is hear about these things that you've done. And that's, of course, part of the challenge of interviewing, because we're not used to talking about ourselves and the things that we've done in the manner of the interview. And so that requires some preparation. But I know, having talked to almost all of you, I know how hard that you've worked to get to this point. I know what it's taken, right? From our very many conversations that we've all had about what you put into this. And knowing that work ethic, knowing your drive, knowing how determined you are, I know if you bring that to your interview prep, that you're going to be in a great position to really create a strong impression. So I don't want you to lose sight of the fact that these programs are excited to meet you. I don't want you to look at these interviewers as your adversaries or people who are trying to keep you out of residency. I want you to look at them as your allies, people who want to hear from you. They want to see you. They want to hear your voice. They want to hear about all these wonderful things you've done. So that's where you're trying to get to. And I know that you can get there. I have faith in you. I'm going to be rooting for you. That's what we're all, wanting for you. All the best with your prep and, of course, your interview. And, of course, you know that you can always reach out to me. Some of you have reached out asking individual questions about yourself. I want to hear about how everything's going. I want to hear about your excitement when you get interviews. If you're concerned about something, I want to hear from you too. Okay. That's what we all want here at MD2B Connect.
Okay, so I think with that being said, I think I will go ahead and wrap things up for the night. I know we are a couple minutes over, but I just want to say that we were so thankful to have you all here tonight. We really hope that this webinar helps you for your future endeavors and for your interviews. And, like Samir said, we genuinely care about your guys' success. And if you guys have any questions about anything, please feel free to reach out to myself, to Dan, to Samir, to Manish, anybody that you're comfortable with reaching out to. We are always here to help you, and we are always rooting for you guys. So if you guys have anything else you'd like to say, just thank you for being here. So Samir, if you have anything to say to send us off.
Oh, it's great to have all of you here. And remember that we do this monthly. So we're going to continue talking about the residency interview in our next webinar in November. So I thank you to all of you for attending, and we are going to be behind you every step of the way. So please do reach out if you need anything.
And did you have any final words, Rajani?
all the best. I mean, what Samir said is so true. We are rooting for you and we're wishing you all the best. Good luck.
Alrighty. Thank you, everybody. Have a great night.